It's my pleasure to welcome you to our fourth annual Wednesday webinar and our keynote presentation for National Public Health Week at San Jose State 2024. As many of you know, I am Angie Buckner. I'm the coordinator for the undergraduate public health program. I'm also a member of the Career Explorations Committee, and we are responsible for planning the National Public Health Week events. So we all know that public health is always expanding, adapting, and preparing. And so today I am joined with colleagues, students, and professionals for a practical conversation on the future of our field. So thank you everyone for taking the time to join us and for choosing public health. And with that, I'm going to turn things over to my colleague, Dr. Vicki Gomez. Vicki, I'm going to turn it over to you. You're muted.
Classic issue. Thank you so much, Dr. Buckner, for that introduction. And just to clarify that Dr. Buckner is actually our fearless leader of the Career Explorations Committee and has worked so hard to make this event a success each and every year. I want to welcome our undergraduate and graduate students, our staff, our faculty, and our community members and professionals. Just so you know how this is going to work is we're going to, have our panel, and after the panel discussion, we'll have time to answer some questions from the audience. You can start entering questions at any time to the Q&A feature in Zoom, and we will do our best to answer them at the end of the panel discussion. So let's go ahead and get started. I'm joined here today with three incredible professionals. Julia Kaplan, Ashley Kissinger, and Marilyn Underwood. To start, I would like to ask each panelist to introduce themselves, to please share their name, pronouns, and a bit about where you are currently working and what you are doing at that entity. So let's begin with Julia.
Thank you, Vicki. Hi, everybody. It's really great to be here. And we were chatting as panelists right before this session, and I was just sharing my love of San Jose State University. And I have such deep respect for you all and for this institution and the public health program, which is, so practice-based. And so we'll talk about practice-based public health more, but I wanted to give a shout out to all of you who are here. I'm Julia Kaplan, she, her pronouns. I'm working from home in Oakland, California, on Chochenyo Ohlone unceded territory. And I am the executive director of an organization called State of Equity. We recently rebranded. We used to be called Health in All Policies, and Health in All Policies is kind of the field that we got our start in, and that work has evolved to really be entirely focused on equity and specifically racial equity. And just a little bit about what I'm doing at this organization, what we're up to. So State of Equity, our tagline is moving racial and health equity to the heart of public institutions. We exist to transform government systems and really hold our government accountable and support our governments to truly be accountable to the communities that they serve. And that means centering racial equity and health equity in everything. So I work with folks not just in public health, but in transportation and housing, food and agriculture, social services, parks, land use planning, climate change, it's a long list, really embedding these principles in everything that government does. And one of the big things that we do now, we spent over a decade launching and facilitating California's Health in All Policies Task Force, which convenes and still convenes about 30 different departments, agencies, and offices around these shared goals, and helps them change their structures, even their mission statements, their strategic plans, their budget allocations to really center health equity and racial equity in their work. That's what we did for our first 10 years. We're now 13 years along, and over the last 7 years or so, our work has shifted to really focusing on racial equity training and competency building for government workers, as well as supporting government workers who are racial justice activists and organizers within their institutions. So I'm happy to, I think I'll stop there, but I know we'll have time for Q&A, and I'm happy to say more about any of that.
Excellent. Thank you so much, Julia. Ashley.
Hey. Hi, everyone. My name is Ashley Kissinger. I am the chief of the state asthma program called California Breathing at the California Department of Public Health. You can't tell. Like Julia said, so happy to be here. Love always working with SJSU students and faculty, and just feel very honored to be in your presence today. So in the state asthma program, I like to tell people that we work in health equity through an asthma lens, because it really is, as part of CDPH, our mission is to serve all Californians and improve health among the masses. In the state asthma program, one big part of our daily programmatic duties is to provide asthma surveillance to the public. So letting people know about how much asthma there, asthma prevalence, ED visits and hospitalizations for asthma and deaths, so that people can adequately assess what asthma looks like in their areas or their geographic areas. A lot of another stuff of our other projects that we do to address asthma throughout California is our largest program is a community health worker training program, where we train CHWs and promotores de salud to deliver asthma education in their own communities, knowing the evidence behind CHWs, how when they deliver linguistically and culturally appropriate education, that health outcomes of the people they serve improve. We also partner with federally qualified health centers, managed care plans, clinics, community-based organizations, local health departments, all y'all, to be able to initiate or develop asthma programs and to be able to improve the health of the people that they serve as well. So there's a lot of different areas that we work in, and it really is to address asthma, and most importantly, the most disproportionately burdened population. So it gets into health equity. So knowing if we are looking at all of California, where the communities are that need the most help, including the populations that live in those communities. So I will leave it at that. I will keep it short and sweet. Would love to dive more into it, but appreciate being here.
Thank you so much, Ashley. Marilyn.
Hello. I too am pleased to be here and be part of this panel. So Marilyn Underwood, currently the Director of Environmental Health for Santa Clara County. She, her pronouns. So you're probably aware that all of the 58 counties, as well as 4 cities, have health departments. And in each health department, well, I shouldn't say in every health department is environmental health, but at least in this county, it is once again in Santa Clara County, part of the health department here. It just went back under the umbrella of the public health department this past year. My folks that do this work, about 150 practitioners out in the field, looking out for food safety, public pool safety, hazardous waste, and hazardous materials compliance, making sure it's being handled correctly. We do land use for people to making sure they get rid of their liquid waste when they can't connect to sewer. So if you think about it, one of the big important aspects of why we all live longer has been attributed to vaccines and sanitation. And sanitation is really what local environmental health is all about through most of our programs. So we're out there every day trying to protect the public, both our residents as well as visitors to our county. And I think that's where I'll leave it for now. And I want to be convinced that environmental health is a really important part for you to get involved in public health.
Excellent. Thank you so much, Marilyn. All right. My next question is, how over the course of your careers have you seen the needs and priorities of public health evolve? And I'm going to start us off with Ashley, please.
Oh, thank you. So for me, like how public health has evolved, I really think in the past, even just decade, there's been such a push for more health equity centered public health practice. So understand, oh, oh there, oh my goodness, all of a sudden I got real big and I thought I did something. Hi everyone. Okay, we're okay. Seen a big shift in a health equity centered public health practice. So understanding like how to, when you have an issue that you're looking at, where geographically where that issue is focused on and how and who is most affected. So understanding disproportionate burden. So for example, in the state asthma program, we know that Black communities suffer a disproportionate burden of asthma compared to all other racial and ethnic groups. Black communities suffer 5 times the amount of ED visits and hospitalizations compared to their white Californian counterparts. So that's just an example. So when we know that, like, how does that affect our programs and the way that we work in communities? So I think for me, and we have been funded by CDC for the past 25 years, and even seeing their shift in the proposals that they call for, there's so much more health equity language and deliverables that they want to see, and that's reflected in what we all know as also the social determinants of health. When people have access to transportation and quality education, food, everything else that I could list like 80 things right now. We know that they, then can focus on the different areas of public health that we all work in. So for me, I think it really is a focus for health equity and racial health equity and understand burden.
Thank you so much, Ashley. I would now like to have Marilyn answer that question. And just in case, the question is, how over the course of your career have you seen the needs and priorities of public health evolve?
Okay, I'm going to stick with still in like part of my career where I've been in environmental health, but both through formerly being the director of environmental health in Santa Cruz County and before that in Contra Costa County, I feel like the emphasis also I would say is it's a slightly different way of, I don't know if we used the word equity years ago when we started it, was to make sure that when we have such a diverse group of people that we regulate, both in the food industry and in the hazardous materials industry, from auto body shops to gasoline stations, that we have different diversity that need the message delivered in a way that they can receive it best. And trying to understand that, they may have a violation, not because necessarily they want to violate, but because they don't really understand properly why there is a violation, why they need to correct it and do correct their behavior or how they're handling it. So I would concur that I think more recently we're starting to call it equity, but it was definitely for years understanding that our education has to be in our efforts in regulating have to take into account the diversity of the folks that we're regulating. And I've definitely seen what that means is the ability to have good communication skills is even more important in our staff that we hire, oral and verbal communication skills. And to be honest with you, really the need for oftentimes the ability to have a second language, be fluent in a second language for us is really, really important so that we can address our communities. So that's what I would say I've seen over my career in environmental health.
Thank you so much, Marilyn. All right, and I would love to have Julia answer that question. And just in case, over the course of your career, have you seen the needs and priorities of public health evolve?
Thanks, Vicki. Yeah, I echo what's already been said. And, I think one of the things that I've seen, and I can think about the course of my career, and then I try to think about also what came before my career, which I wasn't here for, but I like to listen to my elders and their stories. And I think for a while I had the narrative that public health, that this idea of social determinants of health is like new, and it's like the new wave of public health. But actually, if we look back at the roots of public health, I mean, things like sanitation and clean water, these are social determinants of health and equity. And they're totally about public health getting beyond the health lane and really looking at health across all policy areas and policy fields. So I do think that the current and growing, deepening understanding of public health is much more about these intersections around policy areas, but I also want to name that that's actually rooted in the historical tradition of what public health is all about. And I think, yeah, so I wanted to name that. I think that I have seen a shift with now a much greater clarity of understanding about the relationship between racism and health harms, and understanding that racism is the key driver of health inequities. I think a better understanding that the cause of health harms is not race, it is racism. It's the oppression, um, and being able to have an oppression and liberation lens in public health. Um, I think about I assume, I hope that all of you on this call are familiar with the Bar-High framework. Um, and I can drop a link into the chat. Oh, this doesn't go to everybody. Oh, I can have it go to everybody. There we go. Of the Bar-High framework. But I think, when I learned about traditional public health, it was about what's on the far right of the framework around disease, injury, mortality, and then people started moving up towards risk behaviors. And of course, I think it's much more clearly understood now that risk behaviors have everything to do with living conditions, with institutional inequities. I was on a flight yesterday with a guy, a chemical engineer. I was chatting with him, but he cares about food justice. So we were talking about that, and he got it, that what decisions you are going to make around how you eat, which we might classify as behavioral health, are really about what's available to you, what's in your neighborhood, what can you afford. And I think more and more there's an understanding, and this is more kind of on the cutting edge of public health, that institutional inequities and living conditions really are the result of social inequities. And so looking at these broad conditions of our society and culture, around class, around racism, around immigration, status and policy, and getting, up into those pieces of the environment. I think it's also important to name climate change as public health emergency. I'll talk more about that in our next questions. Oh, and I think the piece around things coming full circle is, when I was studying public health, I kind of thought, oh, vaccines, that's like, old traditional public health, but that's not like on the cutting edge. We all saw through COVID that vaccine equity there's so much about vaccines and messaging and communications and trust in public institutions and equity and access. And, I think all of the ways that COVID helped us understand that infectious disease is, completely about social determinants of health. So I think those connections.
Thank you so much, Julia. All right. Our next question is, and I'm going to have Marilyn kick us off. What do you feel are the most significant future directions of public health?
For us, and I will just say it's workforce development for sure. I mean, I know that every one of my directors that serve in other counties and the cities are all really wanting more folks to not grow up to be a doctor, not grow up to be a fireman, but grow up to be an environmental health specialist. So we're all needing additional staff. And again, we can talk about in the next question some of the skill sets in that. But it's really important because we have a huge need and not enough folks that are right now in the field. And I think it is a really rewarding field. So I think COVID actually has really increased the interest in like becoming an epidemiologist and becoming other parts of public health. But again, I'm going to keep promoting environmental health and joining in the field of environmental health. Um, in addition to things I think that the environmental health specialist works on that I've already mentioned, the other thing is that climate change, we don't really necessarily work directly on climate change. We have some, in certain counties, we have some important role in water resources, especially under the water basin that we all are seeing some of our water basins um, um, drained and now needing to address water quantity. And they often play an important role. But another role that we play is from the impacts of climate change, whether it be responding to post-flood or post-fire, and some of these impacts that we're seeing, and just a really important role in the field, helping respond to the people that are having those impacts. Just for an instance, I came from Santa Cruz County, and after the fires there where 940 homes were destroyed, my staff were out there assessing the impacts to each of the properties to assess the hazardous waste the impacts of the hazardous left on the properties, assisting US EPA and the Department of Toxic Substances, who were going to doing some major cleanup of those properties. We also helped with re-entry for those folks that wanted to go back to their properties and safely be able to look forward, like sift through the ash in some cases, and we gave them like kits that would protect themselves, but allow them to be able to re-enter and go through their burned housing. And then lastly, we helped through the cleanup of their properties, engaging all the properties in signing entry to their property so that we could clean up the hazardous material there. Because it turns out as you have massive fires like that, and then you have water runoff, you now have contaminated water streams and you have contaminated things downstream. So after a major fire, there's this huge cleanup effort that has to happen. And our staff are out there every day to facilitate folks getting access to those properties. And took several months I think it almost took us a year to do that for those 940 properties. So again, environmental health will continue to play, I think, an important role as we see, unfortunately, some of these impacts from our climate change and responding to emergencies.
Thank you so much, Marilyn, for that. Next, I'd like for Julia to answer that question. What do you feel are the most significant future directions of public health?
Sure. Yeah, I mean, I think there are clear themes between the three of us and our responses. You know, I started in my current work 13 years ago doing work on health in all policies. And at that time, it was a pretty new approach in the public health field. It was not new to work on social determinants, although there were certainly a lot of parts of public health that were not making connections to social determinants. So I think we've really seen that shift. But what was really new about the health and all policies work, I think, has been getting out of our lanes and kind of taking up the whole, I don't like the roadway analogy, but I think I have often heard, I actually have been told before, stay in your lane. And I think that's not right. And we belong at the table. I think there is something for us as public health practitioners about deciding and having the confidence to say we do belong at the table. We belong at the table around land use planning and tax policy and child welfare policy and climate policy, and like we belong at the table where major decisions are being made about our society and our public institutions and our social structure. I don't think that the public health structures make that very easy. And I think that it can be really difficult when you're working within an institution. and there's a hierarchy and there are lines of reporting and there are funding streams that are categorical and are narrow, it can make it really tricky. And so I can't say this is exactly what the future is going to look like, but I think it's what the future should look like. And I think a challenge for us is figuring out how to get there. What does it look like to have key public health roles and advisors at, the highest levels of our institutions and our social structures? And then I think, yes, to everything that's been said around climate, absolutely. And I also want to bring war into this mix as a topic area that this is a public health issue, and it's a huge one. And I think it's one where we get told like that's not your business, so do other things. But public health folks are doing the cleanup all over the world around the harms that are being caused by war. And then the last thing I'll say on this is I think there's a really important role for public health as a convener across policy areas. And we've seen this a lot with there's a national movement around racial equity in government practices, and the National Group Government Alliance on Race and Equity, GARE, which is not a public health organization. But when we look at the government jurisdictions across the country that are active in this racial equity movement, many of the jurisdictions that are the most successful have a public health department convening other departments. And I know, Marilyn, you're from Santa Clara County. I know that the Santa Clara County is very active in this racial equity movement, and it was the public health department that first launched the work and engaged that across the county. And now there's a racial equity office, in central county government that's doing that work. But it was public health that got that started and really built the case and got the funding and pushed that through the budget. So, and yeah, so I think there's something about the convening role and kind of being the connectors between these areas that's a benefit to the other policy areas as well, not just to us.
Excellent. Thank you so much, Julia. And thanks also for putting in the Bar High framework link. I know all of my students in the classes that I teach, we have gone through the Bar High framework. So it is such an important framework, and even in some of the research that we do as well. So thank you. All right, Ashley, the question is, what do you feel are the most significant future directions of public health?
Yeah, thank you. Well, I want to thank Marilyn for bringing up workforce development, because I think speaking to all of you who came here today, really want you to keep with public health, pursue public health, go for anything that interests you. We want you to be here. We're rooting for you. We're excited that you're here. So excited to see like what you all do as you leave SJSU. I think in addition to workforce development of right here, I would keep an eye on community health workers and their workforce development, knowing the importance of investing in community capacity building, and community expertise. Governor Newsom invested over $200 million to integrate community health workers in all different types of agencies, knowing the communities that they represent and serve. And so I think it's going to be a boom in public health. And I think the more information you know, the better. And I would love you to carry that on into the next step in your public health journey. I also think, in addition to what Marilyn and Julia mentioned, I think data modernization, I think is what we're all calling it, will really shift things in public health, especially in California. Right now at CDPH, we provide surveillance in all different types of, or all different areas of public health, whether it be chronic disease or transportation or, lots of different things. In asthma, we work with data that has a lag time of 2 to 3 years. right? That is data that looks at like asthma prevalence, ED visits, hospitalizations. We are using data from 2 years ago, and that's the best that's out there. That's the best there is. I would encourage everyone to look into the California Health Information Exchange, which would allow real-time data so it would adequately or allow us to look at public health and even like chronic disease outcomes in real time, because I think that will really make a difference in how we respond in public health programs or even like develop interventions over time. I think the more you know, the better. These are conversations that we are having on the daily at CDPH. So would love for you all to, look into that and bring that into your, next step.
Thank you so much, Ashley. I see that someone's raised their hands, but we're actually going to take questions at the end. So please make sure to use the Q&A feature to ask your question. All right, our last question, and I'm going to have Julia kick us off, is what skills and knowledge areas would you recommend current public health students prioritize to meet these future directions?
Sure. I think I'll just stick with some of the skills that maybe are less common in traditional public health education. So, and this is really speaking to the work that I do. It is going to depend on what you want to do, but I think there's a whole skill set around diplomacy and influence that is, people talk about communications a lot. It's part of it, but there's something bigger around, it's kind of a politics, negotiation type of skill set around influence. How do you change the systems and structures? And that's critical if we're wanting to really move upstream and go beyond implementing specific programs, but how do we get it so that other people can implement those programs? How do we get it so that the funding streams coming down to our communities allow those programs to be funded? How do we get it so that community-based organizations can get the money up front to do the work that they want to do instead of having to do it on a reimbursement basis later, where they have to put out the money first and then get reimbursed, which is a huge barrier to communities doing the work. So there are these things where we're like, well, we're wanting to work on one thing, but actually there are systems and policies we need to change. And rather than having a wish list of what those are, what if we had the skills to really be able to influence some of those things? Partnership, deep partnership. What does it look like? What is the skill sets around building trust, around understanding the priorities and needs of other people and other institutions, and figuring out where there are areas of alignment where we can, work together to pursue common goals. There's both strategic kind of planning pieces in that partnership, but also a lot around relationship skills that are considered soft skills, but are really critical. And then centering community, which I think is kind of a growing area, which some public health institutions and groups have been doing for a long time, but for a lot of public health and non-public health areas of work, there's some big learning curves that need to happen there that goes way beyond asking community for input and really centering community in just the vision and the conceptualization and the design of what we're doing, hiring community members, compensating community members for their expertise, for their time, recognizing their lived experience as valid qualifications for being, truly valued as part of our institutions and our work. And then having a racial equity lens. I think there's a lot of opportunities now more than before to get training in that. And I think even for those of us who may think that we know, we know about equity. We're like social justice minded. We have all grown up in a society that is just bombarding us with oppressive ideologies and messages day after day from the day we were born, particularly if we grew up in this country. And it's really important to get the training and do the work on the ways that we bring things to the table that may be unaware, but also to really learn the tools. Like there's amazing new and developing tools right now about how do you apply a racial equity lens to your budget? How do you apply a racial equity lens to your program planning, to your decision making? All kinds of things that, 5 or 10 years ago, those didn't exist. So there's just big opportunity there. And I think that if folks go out into the workforce with some concrete skills in those areas, it will be very appealing and useful.
Thank you so much, Julia. Next, I would love for Ashley to answer that question. What skills and knowledge areas would you recommend current public health students prioritize to meet these future directions?
Thank you. I will underline Julia's partnership. I will just highlight, underline, circle. I think it is so important to really come away with how to work with communities, meaning, how do you partner, share decision making, really listening. I think that is a skill that is just so needed and it should be done really well. And so I think that is something that I really look for when I bring someone on my team. I will also make a plug for qualitative methods. If you all can take a qualitative methods class, I think that would add a lot of richness to your skill set. I'll just say I partnered with the CDC to provide EpiAid to the Hoopa Valley tribe earlier this year. And they had a lot of quantitative skill sets on their team, but they wanted to do focus groups and interviews, and they didn't have that skill set on anyone on their team. And they looked to CDPH, which they found me, good times, to be able to do that work. And they really leaned on us to learn how to implement or, deliver qualitative method, like collect data and analyze it. So that we can, bring it back to the tribe and have them make decisions. So it really showed the importance of the importance of qualitative methods, and that we really need both to be able to do programs really well. I think lastly, I always look for mapping as a skill when bringing someone on my team. So if you all can take GIS, or if there's the course, or even look at it on your own, I think mapping is a really important skill visually for, internal programs and also for communities across California. I think is a really important skill to bring with you. I'll leave it there.
Thank you so much, Ashley. That is so validating as a qualitative researcher. So I thank you for those comments. And GIS, we do not have a class, but SJSU students do have access to GIS. So that's definitely something. And I know that in the past for National Public Health Week, we have done something around mapping. So thank you for that. All right, Marilyn, the question is, what skills and knowledge areas would you recommend current public health students prioritize to meet these future directions?
All right. Well, environmental health, to get into it, you do need all the hard skills and hard sciences, biology, chemistry, organic chem, and physics. But when it comes to the job, those aren't really as critical as what they call them soft skills, interpersonal skills, because in this case, you really have to engage with the folks that we're regulating to partner with them. Now, it's not partnering in the large organization type that you typically would see in public health, but it's really one-on-one, working with each of our regulated people to figure out how do you help them understand why it's important to do what we need them to do to protect public health, to protect the consumer. So that's really one of the important roles. So it's thinking about teamwork not only with your colleagues, but the folks that you regulate, the communication skills, the ability to understand, nonverbal communication when somebody's not getting it right. So those are making sure that on the one-on-one, you're able to have the most effective communication with them. I would also say that the IT skills are incredible, but I have to say, I always love bringing on new young people because they always have the IT skills. It's really sweet and can influence the rest of us, which is we really appreciate and bring that with them. And I would also just, I know this is not necessarily a question, but in case you don't know what environmental health does, we really would encourage you to call and ask for a shadowing. You can go out with our staff and see what they do and check it out. And just as you might think about a career in environmental health. So would highly promote that.
Thank you so much, Marilyn. Just so you know, all of our undergrad students and our graduate students do have to take an environmental health course, during their trajectory here at SJSU. So thank you for illuminating further. Thank you to our panelists for answering the questions that we had. And now we want to turn it over to the questions that we've been getting in the Q&A. And I think this next question is really, top of mind. For a lot of our students. So you have each spoken about workforce development and the need for more workers, but the jobs are hard to find. What recommendations do you have for students or recent graduates who are not finding jobs? Anyone who would like to answer that question? Yes, Marilyn?
I can just say, I can point to a lot of different people, including ourselves, that are actively looking for folks to come into the field. So go to the Santa Clara County Employee Service Agency website and see what opportunities we have. But I can also tell you most county environmental health directors are looking for folks. So really encourage you to go look there. You do have to have certain criteria. And to do that, I would encourage you to look at this California Department of Public Health, CDPH. They have part of their website talks about the registered environmental health specialist and the requirements for that. So I would encourage you to go look there. It really helps because you end up getting a letter that allows you essentially to say, hey, I can get a job with any county that's has a need.
Excellent.
I can drop that in the chat too.
Please do. Yes, Ashley.
I would also say where you are looking to get a job, if there's any type of informational interview you can do ahead of time, or look how to tailor your resume or statement or whatever's required in the application. I know that for CDPH, our hiring process is not very straightforward and not friendly to people outside of CDPH, which doesn't make sense. But when we know that someone wants to have a state position, I help mentor people to understand like what the application process looks like, what language to use, and those people end up on the state list to apply for jobs or end up getting state positions. So always happy to extend that type of mentorship and expertise, and I'm pretty sure that other people at other organizations would as well. So sometimes like it might be the systems that might be, the barriers. So always think of that.
Thank you so much, Ashley. Julia, did you want to add to that?
I'm wishing I could just be like, here's a whole bunch of jobs. It's hard, so I want to just like validate the experience and what you all are up against. And I think it can be really scary to not know what's going to happen and be graduating from school and it can feel very vulnerable to put yourself out there. I echo like the informational interviews. I think I don't call them that in my mind because I think informational interviews sounds like you're interviewing somebody about what their job is. And I got some really good advice from somebody when I was finishing up graduate school from a professor who said to do a round of networking conversations, coffee dates, those kinds of things that are really about doing an environmental scan of the kind of work that you want to do. And so instead of asking people, will you tell me what your job is, the questions are a little more along the lines of, I admire what you do. I'd like to do work in a similar field. And would you be willing to tell me, meet to tell me about it's kind of the questions that we were asked today. Where do you see the field going? What do you think are the cutting edge issues? What are the things you expect to be priorities in the coming years? What are the organizations to keep an eye out for? I think those are more interesting questions and can be more interesting, like for somebody who receives the question. Those can be great conversations, and it's valuable information. And one of the things it can tell you is when you're asking the questions about what's on the horizon, um, websites only go so far. Usually websites reflect work that's already been done. They don't reflect what's happening in the future, and they rarely reflect what's happening right now. And so it's a good way to kind of get that sense. I also recommend, I guess with Zoom, and virtual meetings, you're more likely to just send your resume ahead of time. But you can also create a one pager that's like a little flyer about yourself that could have your photo and profile and kind of like a fact sheet that's a lot easier to look at than a resume. I used one of those also when I was looking for work after graduate school and would send it to folks along with a request for a call. Sometimes resumes can be a little difficult to sift through, and it's a way of figuring out what you want to highlight about yourself. And it's something that they might then forward on to someone else.
Thank you so much, Julia, for that. I really love that tangible piece of advice. Another question from one of our students is from our very own Trevor. Can you tell us what inspired you to get involved in public health? So what your inspiration was? Anyone who would like to take that question?
I can go first. I think I was really inspired to get involved with public health after serving in the Peace Corps. Having been exposed to like community health, global health, in essence, public health, I was like, I think I should maybe go to school and learn about this because I did my undergrad in like bio and biochem, and I felt like I could map, genes, but I couldn't talk to humans about health. So I think once I started in public health, I actually studied environmental health in my MPH and jumped around from environmental health to community health, occupational safety and health, to chronic disease management. And this kind of goes to Rachel's question in the chat as well. I was actually really surprised at how much I loved every single area of public health that I worked in, even though they are maybe not interconnected, but still in the realm of public health. I was just so surprised and loved the people that I met in every area. You find so much passion, compassion, just expertise. And once I started, I could not stop. And I'm still on that train, the learning train of public health. I love it. So it really, for me, was on the ground experience, just being exposed to it. And I was like, I have got to learn more. And it really was learning from experts in the community and seeing what we could do to improve the health of communities all over.
Thank you so much, Ashley. Anyone else want to answer that question? Can you tell us what inspired you to get involved in public health?
Go ahead, Julia.
Well, I was a social justice activist for a long time before I found public health, and I didn't know what public health was. So I think in retrospect, I was doing public health for a long time, and it took me meeting my partner actually, who when we met, she had just finished her MPH at San Jose State University, and they helped me see. I was wanting to go to graduate school, and they helped me see that public health would help me along the path that I wanted to pursue. So, but it really was about social justice.
Excellent.
And I
Thank
will say, I just went into it kind of got exposed to it by accident. I got my PhD in pharmacology and toxicology and was working in the site mitigation field with a private contractor. And then I got hired at the government level. And it happened to be housed with this, at that point, the emerging program at the state level for childhood lead poisoning prevention. So I saw that getting launched right next to me. And then later, California Breathing and biomonitoring program, all when I was working with the state health department, and really so inspired to then see the role that public health plays. So that's how I got inspired. It's next to it.
Excellent. Thank you. I always believe that everybody has, like, they can pinpoint, do you know what I mean, what it was that, brought them to this field. Our last question, and I do see that there's a very specific question to our panelists, which they can see and maybe can answer within the Q&A. But the last question is from Dr. Berkowitz. Thank you so much for being here. And Ashley already alluded to this question, but what has been the most surprising part of your journey in public health so far?
I kind of already answered it in my other one. So I was just, yeah, my apologies. But I think the most surprising thing for me was just being very open and like wanting to explore lots of different areas in public health, and really just, falling in love with different areas and different ways of doing things. And yeah, that's kind of my journey. I was really surprised at how taken I was with lots of different facets of public health, and it's kind of brought me to where I was today.
Thank you, Ashley.
I was going to say that I was actually feel like I was very ignorant about the importance of social determinants of health. And I feel like that points out the important role that public health has played in bringing that to the forefront. And I think there's so many people out there in the world at large that still are not aware of that. But it just points out the importance of it and making that an important role in how we at the local level, as well as the state level, carry out public health and where we spend our dollars and our emphasis. I think that's really, I was shocked, to be honest with you, uninformed. And that's probably because I didn't come up through an NPH program or our public health program, but a more traditional science program. But that's what was shocking to me.
Thank you, Marilyn. Julia, anything what's the most surprising part of your journey in public health so far?
Yeah, one thing is there was a moment of surprise the first day that I had my job doing health and all policies work, and I was actually in the Department of Public Health. My team was housed there for the early years of our work. And my first day, my new phone rang at my desk, and I answered it, and I was so excited. And it was a community member in, I don't remember where, but somewhere in California. And he was really angry and was demanding to know what we were doing and how we were doing it differently. And it was literally my day one. And it was an awakening for me about the lack of trust that I just did not understand until I was in that seat. And I had come from being an activist. And so I wanted to be like, wait, we're on the same side. And it led me on a path that I am still on now, 13 years later, of really trying to unpack what it looks like to truly be accountable to community and be in partnership with community. Because I think my knee-jerk reaction was like, I am in partnership with you. And then I had to really realize, well, actually, we're in this larger institution and set of structures, and like maybe we're not So, and then the other surprise that's continually surprises and delights me is how many people there are within the field of public health and within government and just public service who are there because of a deep, deep caring for humanity and who are really, I think there's this myth of like which I think is actually really rooted in the myth of the lazy government worker is, I think, actually really rooted in classism and racism. And there are so many government workers who are true public servants and are really there uh, for the social good. And yeah, that's been a learning for me.
Thank you so much for sharing that perspective, Julia. We talk a lot about community, and the work that we do, and really, trying to work with communities and not on communities. So thank you for sharing that. Thank you all to all of our panelists for just taking the time to be with us today, for answering all of these questions so thoughtfully. I apologize that we could not get to all the questions just because we do have an end time of 2:30. So I'm going to close it out by saying thank you to everyone for attending today. All of us students and community members and panelists and faculty and staff, it really means a lot that you spent this last hour with us. The recording from this panel discussion is going to be posted on the NPHW at SJSU 2024 events page. I trust that Dr. Buckner is going to put that in the chat for me. We really hope that you will join us for other events. We have an exhibit at the library and drop-in advocacy workshop tomorrow, Thursday from 3 to 5 p.m. An event that is hosted in collaboration with Black Maternal Health Week. We have a professional development training, learning how to use Adobe Portfolio on Friday at 12:30. And on Monday, we have another collaborative event with the Black Maternal Health Week, which our very own Dr. Rachel Berkowitz is a part of, and a screening and discussion on the film Laboring with Hope. So we really hope that you will join us for those events. Thank you again to our panelists. And finally, we will be sending an evaluation that we hope you'll complete so we can continue to plan events that are of interest to you. And we hope that everybody has a really lovely rest of your afternoon. Thank you so much, everybody. Thank you to our panelists.